Good morning. Welcome everybody. The 7 million views, the 15,000 subscribers. You missed the Chiro Guru. We're making a video. Everybody should be happy. At least I hope. I have with me Dr. Brent Kimball, 5280 Neurosurgeon of the Year in Colorado. And I'm Dr. Vetanze, the Chiro Guru. Why are we here today? This video today is made for you, the patient, who's having a lot of back pain, nerve pain, and is thinking about having a neurosurgery done, relieve your symptoms. What should you do? What surgeon should you see? You chiropractors who have a certain type of practice and don't use necessarily a system when you're using your chiropractic adjustments and don't have a goal of, rather than adjusting a vertebra, of balancing the entire spine. And thirdly, maybe a neurosurgeon, if you want to increase your outcomes, get away from fusion, at some point, maybe this kind of video will help. We're making this video because of a subject called bipedism. Bipedism means 2 feet, or bipedalism, whatever you want to call it. And we're human beings. We have 2 feet. We stand up in gravity, and we're upright, and gravity's pulling us down constantly. Why is that important? There's a lot of different treatments. Easy treatments, conservative treatments, radical treatments. Just as many outcomes. Can we discover something by having two professions communicate where we can greatly enhance outcomes for you, the sick person? For you who's watching this right now, of these 15 million views or whatever we have around the world, saying, Dr. V, what should I do? Should I get my lined up before I have surgery? Should I not? So this is what it's kind of all about. Can, by our communication here today, start something that'll make it better for you. Chiropractors, your conscience. Look at your conscience. Are you satisfied with someone coming in, giving them a 3-minute crack, adjusting from a 2-dimensional x-ray, doing an HIO, doing whatever, your type of treatment, see how many people you can take care of in a week, see how many contracts you can sign? Are you happy with that? Are you a doctor? What is your system? Are you adjusting the right vertebra, the right way, the right angle, the right depth, in the right order?
So I'm going to add just a little bit to that.
Yeah.
I'm really excited to be a part of the conversation. I think that there's a lot of goodwill coming from the medical side and coming from the chiropractic side. There's not a lot of communication or collaboration that's happening. I'm hoping that we can open that door, have more crosstalk, have more communication, because there's a lot that's being done on the chiropractic side that I don't understand, and there's a lot of stuff that I'm doing that maybe or that the medical community and in the spine and neck and back pain and sciatic, those are the things that we're looking at every day, but you're also looking at them, and the fact that we're not communicating is just ridiculous, because there's more opportunity to collaborate. We're both addressing or trying to address the same problems,
Exactly.
but we're not working together on it. So this is an education for me, and I'm hoping that we can just open that door and also provide some confidence for our patients that they can get this combined approach and ultimately help more people. That's the end goal here.
Thank you, doctor. I mentioned the word bipedism. In 1973, if you go back, you read a paper written by Dr. Joseph Jancy on bipedism. He was the president of the National College of Chiropractic, my mentor. And so when I started practicing, I got all his papers from where I sit, when he spoke about the chiropractic community and we ought to quit fighting with each other. Of course, that hasn't happened. Okay, where he wrote about bipedism, on and on and on, the details. And he adds in Dr. Fred Illy and his research, and he adds in Major Descharnay and the sacro-occipital technique. When they start talking about, this is what chiropractic can accomplish. It can become sophisticated. It can become complicated. It can become, gee, you can be a doctor of this, rather than a quickie quack cracker. Well, to be a doctor, by using your hands, you got to be complicated. Understand the complicated diagnosis. Okay, understand how to use and do your treatment, do your technique, and more importantly, a system. Since you're considering bipedism and the effect of gravity and uprightness, which vertebra do I adjust first? Or is it not a vertebra? Since it's bipedism and you're upright, do I start with the feet? This is what a system, a pattern, that every time tells you the truth. Every time you get a structural reaction, it's consistent. I got 3 doctors here from out of the state that are visiting. Okay? You got Dr. Vigil from Vegas, you got Dr. Garner from Texas, and you got Dr. Draper from North Carolina in here to learn. All right? And what I'm trying to show them is not only exactly specific things to do, the pattern. We're human beings. We have 2 feet. We're upright. Bipedism. Period. Dr. Jancy, may I say?
Sure.
Is his grandfather. Wow. 4 years ago, or 3, when did we have dinner?
I can't remember.
Yeah, whatever. So we had our first dinner with the Dr. Yoakum, and this is the greatest amount of respect. I can't wait to meet this guy because I loved his grandfather, right? And he's talking. He says, you know what? Fusions are no good. They're just not the answer. I go, oh. I like that. He said, got to come up with something different. If we can, I'm going to develop some techniques. And he's a master completely. He worked on my back, saved me. 6 weeks ago? Yeah. So he says, if I can get a vertebra to change 2 or 3 millimeters, it would be huge. Then not have to fuse. You take the pressure out. You can explain more, okay? And I'm listening, and I'm like, doctor, I can change it 10 millimeters. He goes, what? With gravitational pattern alignment. Our system of analyzing your upright posture. Chiropractors, the system of analyzing upright posture. Patients, the system of analyzing your upright posture. Okay? To see where you're out of alignment and make you as perfect upright alignment structurally as I can. Changing a little bone in the foot can change a vertebra, even your occiput, your head.
So everything's about bipedism, right? And
yes.
I've read
yes.
Dr. Jancy's papers on bipedism, and probably no news to the chiropractic community of why bipedism is so critical, because we are the only species that is built that way, and that's one of the things that makes us so unique. But even in the medical community, we don't talk about bipedism. Maybe we have a little biology course on the evolution of mankind, but we don't sit there and always focus on, well, what are the dynamics of standing upright? I mean, there are some orthopedic, indications for discussing that, and we look at postures and balance and scoliosis, but some of those discussions are relatively new, and we're looking at mathematical angles, and we're trying to figure out how can we reliably reconstruct or change what nature has taken away. But those are massive changes that we're making, and they're risky procedures, and they can have downstream consequences. Even if we make something look good today, it's not a guarantee of future results all the time. So our job, and I talked to Nelson about this earlier, my job as a neurosurgeon is, what I focus on every day is identifying where is the pain, where's the problem coming from, and I'm not connecting all the things that you're connecting. You're looking like globally. What is the global response in this human being, endocrinologically, hormonally, from a spinal malalignment, right? I'm not thinking that way. I'm trying to be more simplistic. The immediate thought is well, the surgeon or the doctor is bringing more detail and thinking. We're not thinking necessarily that way. We're thinking, what is the problem? What is your problem? I can't focus on all these other problems. Try to whittle it down to a specific problem, and how can I fix that problem without causing more problems? and isolating something. But the truth is, the human body is very complicated, and everything's connected, right?
Yes.
So I won't speak for everyone. I don't do a great job at connecting that all the time. But having a chiropractic community and some crosstalk there where we can communicate about it, we can rely on having partners that are also thinking that way. I see myself as a last option for patients when nature's taken away or trauma has inflicted something that wasn't supposed to be there, and it has the patient has maximized their less invasive therapies, or the body has somehow lost it's beyond its ability of self-correction. And whether you believe in that or not, I do. Otherwise I couldn't do what I do every day. I have to believe that something is broken and cannot be fixed without my help. Right? Everybody, we have to, right? Otherwise, why would I do? I couldn't get up every day and do what I do.
Amen.
So I'm super excited about this conversation, understanding more about the interconnectivity of all the adjustments, their downstream effects on patients, and how they can avoid surgery. Because we don't want to, I think that there is an easy way to look at surgery as, well, surgeons want to operate on everything. The truth is, we don't want to operate on it. We only want to operate on patients that are going to get better, right? That said, this is what we do for a living, so we either recommend surgery or we don't recommend surgery. Those are the only two options. And if we can't fix you, if we can't help you, we got to find somebody else that can. And so that's where the communication needs to be vitalized.
Man, music to my ears. Thank you. Self-correction. We stand up, the brain balances us out, the eyes will go horizontal so you're not crooked. Self-correction is happening every day you're standing up and walking. If you have a deficiency in your pedal foundation, foot foundation on the ground, it's throwing out your foot, throwing out your knee, throwing out your hip, curving your spine, and you're not in perfect alignment. Well, the Lord was perfect, so we're not going to be perfect, but as perfect upright alignment as you can attain. Self-correction. If someone is going to be scheduled for surgery, and we've had mutual patients, and for the most part, the results have been all good. They haven't been bad. But deviate. You get a new hip, and you've heard me say these on other videos, and the patient's coming in, Dr. B, I'm getting a new hip. Check my pelvis. I says, thank you. You got a 2-inch short leg, you got a pelvis that's shifted, you got a head of the femur twisted on both sides. They're going to operate on one, but they're not going to change the house where the head of the femur lives, but they're going to change and put a new head of the femur in, which would further destroy the house. I'm saying, when you do GPA and you use a drop table and you balance the feet, you balance the ankles, you balance the knees, you balance the hips, pubic bones, pelvis, head of the femurs, boom, lined up. And if they go to get their surgery and the surgeon opens them up, I assume, okay, and let's balance you out here. I've got 2 new hips, so I'm not speaking out of turn, all right? So the surgeons balance the hips, but they're balancing and giving another short and long leg because the pelvis is still out of alignment. So I'm saying, surgeons, please consider this. I don't know if anybody does, but I tell my patients, get in here before you're having hip surgery to balance your pelvis out. Then your hip won't give out in 5 or 10 years and you happen to have a new hip. Now we talk neurosurgery, okay? Key word when he says 2 to 3 millimeters, I said, Doc, we're onto something here. We can do this with GPA. By changing the pedal foundation, if you have a dropped arch in your foot drops down. You're short on that side. That's called a navicular bone drop. Okay, the arch drops, dropped arch. Your foot goes down, turns in, throws out your hip, pelvis crooked. Your body has to realign all the way to the top of the head because God made you to be balanced perfectly straight up standing without deviating.
So I'm going to interrupt you.
Yeah, please.
So one of the reasons why GPA makes sense to me is that you're starting from somewhere. You're starting from a foundation and
Yes.
working up, right?
Absolutely.
Because we've had the conversation about adjustments of subluxations, and if you adjust one vertebrae, and I don't understand, or I'm not familiar with the art of adjustment in chiropractic, but if you're adjusting one vertebrae, in my mind, I think, well, what happened? What about what if the adjustment that needed to happen was up here, and you know it was just more apparent right here, and you're working right here. But you got to start somewhere. You got to have some foundation to build off of. That's what you're talking about. I mean, if I do a surgery, and we think about this in surgery, it's not as nuanced maybe as what you're referring to, but when we operate on patients, we use specific tables. We look for specific bends in the spine. We don't want to extend someone and then instrument them. We want to put them in the proper position, and we have to position them for surgery for success. But if we start with them in the wrong position, then we're going to end up with an issue, right? So same thing with you. You know, if the problem's up here at T8, it makes me feel good knowing that you're starting somewhere and you're building off of the foundation of bipedism, which is the feet. You're starting at the bottom, right? Yes. And then you're moving up.
The whole thing is not chasing symptoms, self-correction, balancing the spine that is going to be a biped upright, and letting at time the brain kick in proprioceptively or whatever and start balancing and sending messages back and maintaining a perfect as possible posture. Then either you have surgery or don't have surgery, but if it works passively, then some of the correction you talked about, the 2 to 3 millimeters, is done. And when you get to that patient and they still have to have surgery, of course, or maybe not, your outcome's got to be fantastic because a lot of it was already fixed. And correct me if I'm wrong. Say we don't do that correction and the vertebrae are all rotated. You find in 2 to 4, 6 weeks all the scar tissue's in there because the same irritant that caused the hip to go bad, the same irritant that causing the disc to go bad, the same irritant in this joint that's causing all this pathology, whatever, is still there.
Yeah.
And so, but if you correct it structurally upright, then you come in and fix it surgically. These people are well for a long time.
Yeah, I mean, most of these people you're going to be able to keep out of our clinics. I love it when patients say, listen, I'll have patients come in, and nobody comes in my office not looking for an opinion on surgery. I mean, why would you ever go to a surgeon if you're going to expect, you're hoping that they say you don't need surgery, or you're actually hoping that they say that you do need surgery. That's the truth. A lot of people want to hear, yeah, you need surgery, because they don't know what else to do.
Yes.
And so, but I love it when patients either go to physical therapy or chiropractic and they're able to find things and they come back and they say, I'm doing so much better. And I'm like, we can't make you better than good. That's fantastic. If you're moving in the wrong direction, we can talk about it. If we haven't tried something, let's figure out where to get you in. I want to know that I can send you somewhere and get you, because everybody, we're all dealing with different access points to healthcare, right? All people are doing is accessing healthcare. That's what they're looking for. I'm seeing people, they might not have seen you. You're seeing people, they don't want to see a surgeon because they know what's going to happen. You call a plumber, guess what? You got some pipe that needs to get fixed,
Exactly.
right? So when have you ever had somebody come to evaluate your HVAC and they told you didn't need anything done? There's always something to be done, right?
Yeah.
But the invasiveness of what we do surgically has to be justified. And it has to be justified by whether or not we've done everything else and we've tried every other option within reason. Now, granted, there are times where you need to suggest surgery earlier, but those are pretty obvious most of the time.
You said something earlier where you're questioning other chiropractors who send you patients and they're adjusting this, adjusting that. And I agree with your questioning of like, which one you adjusting? Why? You go to a chiropractor, what's he doing? Oh, he lay me down, crack, crack, crack. I go, okay. I have a hard time comprehending that. I'm a doctor of chiropractic, everybody. I am not a technician of chiropractic. Somebody comes in, I must have a system that's based on engineering, fact, and some bona fide way of consistency that's the same every time. You go to a party, crack somebody's neck. Oh, fun, that's fun. Well, you know, that's not a doctor. Barely a technician, okay? But if you're a doctor of chiropractic and you can potentially latch onto a system where you can go to the neurosurgeon and say, neurosurgeon, my goal was not to just keep adjusting that one vertebra where he's having pain. That's taken decades or whatever to get there. Doctor, I'm going to change the whole upright structure, then posture of this person, and then let self-adjusting take control, and this patient start healing himself, and then send him to you. That's the kind of chiropractic I do. Would that be easily understood?
Absolutely.
And it needs to catch on into the surgical and chiropractic profession, everybody. Chiropractors. I'm sorry if I bad mouth certain techniques. There's a lot of people maybe that are lawyers that should be chiropractors. A lot of people that are chiropractors maybe should be lawyers. I don't know. I've been in this, I'll be 49 years in practice. If you're upset at me, chiropractors, well, guess what? Get in line. Okay? Quit being quickie quack crackers. If you don't like what I'm saying and you turn off this video, you need to watch it again. Have a system of upright balancing and learn how to do it. Okay? That will give us a reputation and a bona fide name and a system that never changes. And it's accurate all the time. Now, anything else?
We could talk forever. So.
Okay, I know, right? Now, I got an interesting thing here. Doctors have never seen me give a treatment in person, have you?
I haven't.
Yeah. So we have another chiropractor here it's a shame that his spine is so messed up. All right, but we're going to fix it. And it's Dr. Garner, we're going to use you as a subject matter, okay?